and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 8 VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable resources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in the show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, on Instagram at CHLY A Sound Constitution, all one word, or Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com.
We would like to start our show by acknowledging that we are on the unceded territory of the Sunemu people, with a broadcasting range that overlaps the Kawatsan and Sliamon territories. This acknowledgement is done with gratitude to the Sunemu people and with the intention to increase awareness about truth and reconciliation processes and efforts here on Vancouver Island. Additional information and resources surrounding Sunemu history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages.
Hi everyone, and welcome to the show. I'm Lauren, your host, and I have with me today my co-hosts, Nicole, Lara, and Jamie. This week on A Sound Constitution, we will be continuing our Health of Healthcare series with an episode about Indigenous healthcare. In 2015, the Truth and Reconciliation Commission of Canada published a report with 94 calls to action in order to redress the legacy of residential schools and advance the process of Canadian reconciliation. Actions 18 to 24 specifically address healthcare for Aboriginal and Indigenous peoples in Canada. As part of our commitment to truth and reconciliation, this episode of A Sound Constitution aims to respectfully shed light on the history of Indigenous healthcare in Canada, share statistics on Vancouver Island's Indigenous population, and to address what's happening in the community today to promote health for Indigenous peoples in a culturally safe and culturally appropriate way. We will also interview registered nurse Connie Paul, who has worked in Indigenous healthcare for 36 years. We're really excited to share this episode with you, so stay tuned for some great information. First up on the show today is my co-host Lara, sharing some of the historical context of healthcare for Indigenous people, as well as the history of residential schools and how they have impacted the context of culture for Indigenous people in Canada. She also highlights some of the Truth and Reconciliation Commission calls to action and what has changed in healthcare since the report's publication in 2015. Welcome to the show, Lara.
Hello, Lara here. Today I'm going to be sharing about the historical context of healthcare for Indigenous peoples, as well as what has changed since the Truth and Reconciliation Commission report was published. Prior to colonial contact, oral history suggests that First Nations enjoyed good health and longevity due to active lifestyle and healthy traditional diet. Colonization spread epidemics through First Nations communities, introducing infectious diseases such as smallpox, influenza, measles, and whooping cough that had devastating effects, including dramatic population decline. Chronic diseases became problematic, including tuberculosis and venereal diseases. In some cases, villages had mortality rates ranging from 50 to 90% of the population. Despite a vaccine for smallpox being available since 1796, it was rarely provided to First Nations. Exposure to infection alongside displacement of Indigenous peoples resulted in poverty, reduced food security, and crowded living conditions, all contributing to poor health outcomes. The Indian Act of 1876 allowed the government to use compulsory hospitalization for First Nations with infectious diseases. During the early 20th century, separate, quote, Indian hospitals were established to treat First Nations peoples with certain diseases, such as tuberculosis, due to, quote, fear of interracial pathological contagion. In the 1930s and 40s, such Indian hospitals were opened, including here in Nanaimo. next, I want to share about the residential schools as well as the Truth and Reconciliation Commission. For over 150 years, over 150,000 First Nations, Inuit, and Métis Nation children were taken from their families and communities to attend residential schools. By the 1880s, the federal government adopted an official policy of funding residential schools across Canada with the explicit intention of separating children from their families and culture. In 1920, the Indian Act made attendance at Indian residential schools compulsory for treaty status children between ages of 7 and 15. The Truth and Reconciliation Commission of Canada concluded that residential schools were an example of cultural genocide, wherein a systematic government-sponsored attempt to destroy Aboriginal cultures and languages and to assimilate Aboriginal peoples so that they could no longer exist as distinct peoples. Children were harshly punished for speaking their own languages, involved in medical experiments, and thousands of students suffered physical and sexual abuse, sometimes resulting in death. The distinct cultures, traditions, languages, and knowledge systems of First Nations, Inuit, and Métis peoples were eroded by forced assimilation. The damages inflicted by residential schools continue to this day. In 1996, the landmark Royal Commission on Aboriginal Peoples drew attention to the lasting harm done by residential schools. Furthermore, I want to draw your attention to the Truth and Reconciliation Commission Call to Action number 24, which states, "We call upon medical and nursing schools in Canada to require all students to take a course dealing with Aboriginal health issues, including history and legacy of residential schools, the United Nations Declaration on the Rights of Indigenous Peoples, treaties and Aboriginal rights, and Indigenous teachings and practices. This will require skills-based training in intercultural competency, conflict resolution, human rights, and anti-racism." And now, according to an environmental scan of Canadian bachelor's degrees in nursing and midwifery programs by Matheny and Fletcher from 2022, of 107 programs, less than 17% met all three cultural safety criteria. More than 55% included culturally safe spaces for Indigenous students. Only 18% satisfied the Truth and Reconciliation Commission call to action number 24 to require Indigenous relevant coursework, and 33% were seen as infusing their curricula with Indigenous related content. These researchers found that most schools have not made substantial progress toward cultural safety, suggesting that nursing and midwifery programs must commit to expanding their cultural safety programming to incorporate multiple ways of knowing and being in their educational offerings. Furthermore, according to the Reclaiming Power in Place, the final report of National Inquiry into Missing and Murdered Indigenous Women and Girls, a paradigm shift is required to dismantle colonialism within Canadian society and from all levels of government and public institutions. Ideologies and instruments of colonialism, racism, misogyny, past and present, must be rejected. Services and solutions must be led by Indigenous governments, organizations, and people. And this is based on the self-determination and self-governance of Indigenous peoples as defined by the United Nations Declaration on the Rights of Indigenous Peoples, including Article 3, which states Indigenous peoples have the right to self-determination. By virtue of that right, they freely determine their political status and freely pursue their economic, social, and cultural development, as well as Article 4, which states Indigenous peoples, in exercising their right to self-determination, have the right to autonomy or self-government in matters relating to their internal and local affairs, as well as means for financing their autonomous functions. So this begs the question of what kind of changes have occurred since the Truth and Reconciliation Commission report. So according to Island Health, one of the ways that Island Health is working toward the creation of safer spaces for Indigenous peoples is through the support and care offered to First Nation, Inuit, and Métis clients and their families through the Indigenous Liaison Nurse Program and the Indigenous Patient Navigators Program. These liaison nurses and navigators help to provide First Nation, Métis, and Inuit clients and families with support and advocacy throughout their journey of care in a variety of ways. As well, I want to draw your attention to the Canadian Reconciliation Barometer, which is a research project led by researchers from the University of Manitoba, the University of Victoria, the Toronto Metropolitan University, as well as Probe Research Incorporated in partnership with the National Centre for Truth and Reconciliation. They measure the progress of non-Indigenous and Indigenous peoples' shared journey toward reconciliation. They provided an update in 2023 based on progress made since 2021. They used 13 indicators of reconciliation to measure good understanding of the past and present, acknowledgement of ongoing harm, respectful relationships, as well as personal and systemic equality. The data is based on nationally representative survey responses of both Indigenous and non-Indigenous people in 6 regions across Canada. The report indicates that in 2022, more people were aware of residential schools and their harms than in 2021. As well, non-Indigenous respondents' views became slightly more aligned with Indigenous respondents' views from 2021 to 2022, especially in the areas of reconciling with nature. With these improvements in mind, the report concludes there is still, quote, a lot of work ahead of us. Now, finally, I would like to present some quotations from the Honorable Murray Sinclair, who sadly passed away quite recently. He was an incredibly inspiring Indigenous man who was also a senator and the chair of the Truth and Reconciliation Commission. And he was quoted as stating, "When I was chairing the Truth and Reconciliation Commission, I realized that getting to the truth was hard, but getting to the reconciliation was going to be harder. Education is the key to reconciliation, and it's still an offense in Germany to deny the Holocaust, and it should be an offense in Canada to deny the existence of this story as well." Furthermore, he stated that residential schools were with us for 150 years until 1996. 7 generations of children went to residential schools, and it's going to take generations to fix things. We have to learn how to talk to and about each other with greater respect than has been the case in the past. We may not achieve reconciliation within my lifetime, he said, or within the lifetime of my children, but we will be able to achieve it if we all commit to working together toward it properly. Part of that commitment is that every year on September 30th, we will stand up together and we will say never again. What we did in this country was wrong, and we will never allow it to happen again.
Thank you, Lara, for your segment. We call on everyone in our community to learn more about the history and impact of residential schools in Canada and to commit to working together towards truth and reconciliation. Here to share with us some statistics on the population and communities of Indigenous peoples in Canada is my other co-host, Nicole. Welcome to the show, Nicole.
As of 2021, 1.8 million people in Canada identify as Indigenous, making up 5% of the total population, a slight rise from 4.9% in 2016. The Indigenous population grew by 9.4% from 2016 to 2021, overtaking the non-Indigenous population growth rate of 5.3% during the same period. Among Indigenous groups, there are 1,048,405 First Nations people, 624,220 Métis, and 70,545 Inuit living in Canada. Indigenous peoples in Canada are significantly younger on average than the non-Indigenous population by about 8.2 years. Over half of Indigenous youth are under the age of 25. By 2041, Canada's Indigenous population is projected to grow by 33 to 79%, with young people making up the largest portion of this increase. The youthfulness of this demographic will likely lead to higher demand for healthcare services focused on maternal, child, and family health as well as preventative care. When it comes to healthcare access, 54% of Indigenous adults rated the quality of healthcare in their communities as good or excellent. 72% of adults reported needing healthcare in the past year, and 12% felt they didn't get the care they needed. Common barriers to healthcare include costs, with 43% citing services not covered by insurance and 22% struggling with the costs of services like childcare or transportation. 41% reported difficulty accessing services due to limited availability, 18% stated inadequate healthcare, and 16% were unable to arrange transportation. Indigenous peoples also value traditional healing practices. 86% of First Nations people living off reserve, 82% of Inuit, and 70% of Métis reported that it's important to have healthcare services that support traditional Indigenous medicines and wellness practices. These statistics indicate the importance of culturally inclusive healthcare that respects and incorporates traditional Indigenous practices. In British Columbia, there are 204 First Nations communities, and nearly 50% of Canada's Indigenous languages are spoken here. Vancouver Island alone is home to 50 First Nations communities, representing 3 main cultural groups: Coast Salish, Nuu-chah-nulth, and Kwakwaka'wakw. BC is also the most linguistically diverse region, with over 34 Indigenous languages spoken, which is nearly half of all Indigenous languages in Canada. This diversity is vital for healthcare providers to understand, as each community brings unique perspectives, values, and practices that should be respected in healthcare settings. All statistics in this segment are referenced in our show notes. Thanks for listening.
Thank you so much, Nicole, for sharing these statistics. It's so interesting to hear how valued traditional healing practices are in Indigenous communities. Part of health promotion is providing culturally safe and ethical care to all individuals in our community. Here to increase our understanding about Indigenous ways of health and healing is Jamie. Jamie's segment helps us to understand the concept of two-eyed seeing and details the various band health centers here on Vancouver Island. Welcome to the show, Jamie.
Hi, it's Jamie, and I'll be discussing Indigenous perspectives on health. So, in Indigenous communities, health is about more than physical wellness. It's a holistic concept that includes mental, emotional, and spiritual well-being. The First Nations Health Authority, Canada's first Indigenous-led health authority, highlights that for Indigenous people, health is connected to culture, family, and a sense of community. Practices like song, dance, and ceremonies are seen as essential to well-being. This view of health isn't just about the individual, but involves everyone around them, including family and community. So two-eyed seeing, which is an inclusive approach to health, was introduced by Mi'kmaq elder Albert Marshall to bring together Indigenous and Western knowledge. Think of it as looking through two eyes, one that sees through Indigenous teachings and one that views through Western science. When used together, they provide a fuller approach to health. For example, if an Indigenous patient is receiving treatment at a hospital, they might be supported in bringing traditional medicines or incorporating ceremonies into their healing process. By combining these methods, two-eyed seeing allows for respectful, collaborative care, something First Nation Health Authority and researchers at Dalhousie University support for better health outcomes. First Nation Health Authority has been pivotal in promoting culturally safe healthcare across British Columbia. This means ensuring that Indigenous patients feel seen and respected within healthcare settings. First Nation Health Authority works with band health centers to make care more culturally relevant, such as involving elders in patient care to offer comfort and traditional knowledge. This focus on respect helps Indigenous patients feel safer and more comfortable seeking medical support, as they know their cultural values will be honored. There are band health centers that support Indigenous health near Nanaimo, and I'll discuss a few of them. In and around Nanaimo, we have several Indigenous health centers that support community health with a blend of traditional and Western methods. These centers work closely with the First Nations Health Authority to offer holistic healthcare that reflects Indigenous teachings. For example, we have
Stumanis
First Nation Health Center, which is located south of Nanaimo and offers primary health care alongside traditional practices, such as medicine gatherings and community workshops. By including elders and knowledge keepers, the center supports holistic health by bringing together family and community in the healing process.
And next we have Snanawas
First Nation Health Center, located in Nanoose, which provides services such as chronic disease management, prenatal care, and mental health counseling, all while respecting traditional knowledge. This center emphasizes two-eyed seeing, integrating traditional teachings with Western healthcare to meet the needs of its community members. And next we have the Qualicum First Nation Health Services, which is located in Qualicum Beach, and it focuses on culturally safe healthcare by providing primary care, mental health support, and elder-led cultural programs. The center incorporates land-based healing, where the community members participate in gathering traditional medicinal plants, helping them reconnect with their culture as a form of resilience and well-being. And we also have the Cowichan Tribes
Stapleton
Health Center, which is located in Duncan, and it provides comprehensive healthcare services that blend family health, mental health, and traditional healing. The center hosts cultural workshops and community events, such as cedar weaving and traditional food preparation, which brings families together and strengthens bonds. They emphasize that healing is a communal journey where family and elders play a crucial role in health and wellness. These health centers create environments that prioritize cultural identity, community support, and traditional knowledge, offering Indigenous people healthcare that respects their values and promotes a strong sense of connection. For many Indigenous communities, health is grounded in family and identity. The First Nation Health Authority's wellness framework highlights that family support and community are central to well-being. In Indigenous models of health, healing involves more than the individual. It's collective, involving family members and wellness activities like shared meals or group ceremonies. Dr. Karina Walters from the University of Washington's Indigenous Wellness Research Institute shares that these family-centered approaches help people manage challenges like intergenerational trauma. For example, families might attend a healing ceremony together, supporting each other and building resilience, a practice that's culturally reinforcing and mentally healing. The First Nations Health Authority's Bringing Traditional Medicines to the Hospital initiative allows Indigenous patients to incorporate cultural practices into hospital care. For example, a patient may bring traditional medicines like sweetgrass for a calming ceremony before surgery. This approach helps Indigenous patients feel respected and comfortable in Western healthcare environments. According to the First Nations Health Authority, integrating Indigenous practices has improved patient satisfaction and health outcomes, creating a stronger, more supportive healthcare experience. Through the efforts of organizations like the First Nations Health Authority and the dedicated band health centers around Nanaimo, we see how healthcare can be transformed by embracing both Indigenous and Western practices. By honoring traditional knowledge, respecting family bonds, and fostering culturally safe spaces, these centers provide a powerful model of inclusive, holistic healthcare. This integrated approach strengthens cultural identity and community resilience. And as we move forward, it's essential to recognize that true healing happens when health systems respect and reflect the values and traditions of the communities they serve. Thank you for listening to my segment on Indigenous ways of health and healing. It's Jamie. Thank you.
Thank you, Jamie, for helping our listeners understand how Indigenous ways of healing connect with Western healthcare practices to support culturally safe and inclusive healthcare for Indigenous peoples in our community right here on Vancouver Island. Hi, listeners. I have here with me today Connie Paul. She's a registered nurse who has worked in Indigenous healthcare for 36 years. She currently works at Nanaimo Health Center here in Nanaimo. She has a wealth of knowledge and experience and has graciously agreed to share some of her knowledge and stories with us today. Connie, welcome to the show.
Good afternoon. Really appreciate, and I'm always honored to speak to students and the public in general. So you asked that we open this in a cultural and safe way. So what I can do for you is actually open this meeting in the same way we would open a staff meeting. So we start that with, I guess you can call it a blessing, right? So that whatever work is done, we create a safe space for both of us and our listeners. Okay?
Okay.
Thank you, Creator, for this sacred circle this afternoon. Really want to thank you for all the work that's been placed in front of us, that the work that we do sheds light on all those that we care for. Please watch over our fallen brothers, shed light onto their darkness, and bring them home and let them know that they are loved and valued in the world. Please, Creator, we are mindful that there are other countries that don't have the peace on the land that we share here in Shanamuk. Please watch over their children and their elders and their vulnerable populations. Create safety throughout the world. Ashasiyam, Asiyam. Thank you.
Thank you. That was very beautiful. So to start our interview, Connie, can you tell our listeners about yourself and what your role is?
A little bit about myself. I have my Indigenous name is Thalthithawit. That's my Coast Salish name. So if ever I was standing in the dirt of our longhouse, that would be the name that I would use. If I was standing in my mother's territory, she's from the Okanagan Indian Reserve, that name would be Yetta. If I'm standing in the colonial setting, hospital, it would be, Connie Paul RN. That's the name I would use. I'm a nurse, been working a long time in First Nation communities. I've 18 and a half years as an outpost nurse. And I've worked for the Shenandoah here for the last 15 years. I've worked as their home and community care nursing manager for about 14 years. So the last year I became the primary care medical manager. So that's really about community development. So my work has always been about community development. Sometimes community development is on an individual basis. And right now it's more like more vision, more work that's done in terms of developing proposals and creating policy and creating a place of work that blankets our people, so our allied support. So health has really changed over the last 36 years. 36 years ago, here in the community, First Nations Health Authority, at that time, Health Branch, you wouldn't have a doctor working as part of the allied support team. 36 years ago, you would have had a home care nurse, a community health nurse, a Brighter Futures worker, an alcohol and drug counselor, administrator, and some support workers. That has grown over the time, and how you resource funding has changed. So now we have funding from the city, funding from the province, funding from First Nations Health Authority. Some of our funding is ongoing funding that you get continuously, and other funding is grant driven. So, and it's a team approach. So our health center, when we're developing programs and services, our nation here collectively worked together with all the frontline workers and created a model of care called the One Canoe model of care, where the skipper is the client. And essentially, a person can be in a canoe, their own canoe. They can have no one in there, or they can have 20 people in their canoe. But whoever's in that canoe and paddles for that client, it needs to be client-driven. The client determines where they're going in their life and how they decide healthcare impacts them on an individual basis. How many of those seats are filled by doctor, a nurse, an OT, a physiotherapist, a dietitian, a cardiologist, a mental health worker. But it also has to have space for traditional medicine, land-based healing, culture, language, identity, housing, anything that impacts the determinants of health of an individual. So when it comes to work as a nurse, in community development is something that's been there since the very beginning of my career. My very first job working in a First Nation community was a health pre-transfer coordinator. And so, you would be challenged with, how do I create resources based on the size of the band that I'm working for? Those were some of the challenges a long time ago. I think over time, how do we find voice? I think there are certain landmark positions, statements, policies, governance models, depending who's elected, would determine what services would be prioritized for our nations. The In Plain Sight report is a prime example. The calls to action, how healthcare, how we work collectively together to address the concerns of each one of our nations. And I think you need to really look at what does the community needs assessment speak to? So your overall strategic health plan that's formulated by leadership. Leadership brings that back to the frontline workers. Like myself, I'd be a frontline worker. The other part would be an example, land-based healing is important. We need to ensure that we develop programs that speak to our own cultural teachings, our own way of healing that through colonial times was historically not there. It was not recognized. I think Western model does really, really well in recognizing like diabetes, physical, and then, mental health issues. Addiction can be seen as part of physical and mental. And then you have environmental health issues. As a nurse, home care nurse, I'd walk into a home. So when you're walking into that home, what does that whole individual home look like? What are the issues that impact that particular client at that point in time? And how do we all collectively work in the environment? The health of the environment, the physical environment needs to be looked at. And then there's the spiritual part. And I think that's something that we've always been aware of, that our environment needs to heal. And so we have spiritual ceremony that takes care of land. Probably something we don't realize is a part of health, but it's been a part of our way of being throughout time. Like, we've been here for 500 generations. And, after the Indian residential school, some of those teachings have survived. And now we need to fix up to take those teachings and saying, there's a place for these teachings. And how do we integrate that into our way of life? So as a frontline worker, you're trying to combine environmental health, emotional health, physical health into one program that you're developing that meets the needs of people, but is still driven by client. The client still has say. So it's important that you kind of try to combine all these different ideas when you're developing programs and services. That's the kind of work that I do.
Wow, that's a lot of information and a lot of work, but how important for community members, and like you said, especially in light of the residential schools and the impact they've had on generations, So it's amazing to see how, even just one person can make a difference with the client as at the forefront at driving the canoe. Really like that imagery. It's beautiful. If you're just tuning in now, you're listening to A Sound Constitution on CHLY 101.7 FM. You've been nursing for 36 years in Indigenous communities, so you've seen a lot, I'm sure. What are your thoughts on how to create change in the system to better support our Indigenous clients?
That's a great question. It can happen on an individual level, on advocacy, on a personal level. I've had clients where the system has been unkind. And so it's not just providing a space for a voice, but how do you change that experience? Well, I remember a scenario where a client was told that he was a frequent flyer in the healthcare system, and the system is not well. And I don't want to blame one system over another system. We can't change which we are not willing to acknowledge. So if we can acknowledge that that was actually said, that's the first piece, is to say, yes, that was said. The second piece is, do we as a community, meaning not just the client and not just the client's family and not just the nation, but the system is willing to embrace that and saying, yes, we need to change that. And that part means, that we have to look at the truth and reconciliation. That means you have to look at that system. Was that said because the system is tired, or the system is exhausted, or the system is frustrated? There's always two sides to a coin. In that person's story, they were unattached. They had difficulty with mobility. They could not get to a family doctor based on their size. It was a big man. And so the only way he can get medical help was call the ambulance, go to the hospital. And that probably is very frustrating, because the cost it takes to admit somebody into hospital, the cost it takes, to people to pick them up, the energy it takes to put them into a vehicle, the energy it takes, all the workers involved when this man is not well. What ended up happening is this person did not like going to the hospital, and he said, I have to be sicker before I will go there because I'm not welcome there. This individual had more than 30 hospital admissions in 1 year. So when we sat down and looked at the system, why did that happen? Unattachment, transportation, family, the ability for family to get a big person into a vehicle, for a family that had no vehicle, get him to the hospital. The chronic nature of all his illnesses. And then you have to look at that time, the workers themselves were exhausted. The frontline workers on the other side of that were exhausted. There was short staff, summertime, people were on holidays. They were exhausted, frustrated. And you're having somebody whose medication needs to be better treated. So it had many, many factors to look at that. So it takes a community to really look at this issue. How does that happen? Who needs to be at the table? Well, you need to have family at the table. You need to have the allied support that exists within the nation. You need to have Island Health. You need to have BC Ambulance. You need to have the Emerge Department. And we need to take that problem apart and say, how can we do this better? And as it turned out, there was a pilot project for a visiting physician to the home of those that could not leave the house. And so within 12 months, those 33 visits turned into once a month visit with the doctor and only 2 hospital visits. That's far more a way to address the overburdened healthcare system by creating a solution. And of course, so, in that particular scenario was asked, how do we make amends in a cultural way? And that's what we did. So we met with the family saying, if someone is going to say what was said was wrong, don't want to make excuses what was wrong. We'll accept this was said. We believe it was said. We acknowledge it was said. But how do we move forward? How do we move past that and heal? Not just us, not just our community members, but the system heal. And the workers themselves get a chance to, vent their frustrations and how they see a system and put their input. Maybe together we can come up with a better solution. And we did. That's an example, where we still have that home visiting program today to address that very issue.
Everything you've talked about is promoting healthy community development, and that is like a large part of nursing, no matter which field that you end up in. What would you like to share about this work that is being done within Indigenous communities? Are there any other programs that you'd like to share? We have
some others. Yeah. I sit at the Division of Family Practice at the Truth and Reconciliation table. So that's a table where there are more than just Shinemo at that table. There's Telecom House, there's the Métis Association, there's Stenowis, and then there's Division of Family Practice. We have physicians at that table. And so it's really to look at how do we maximize the most services, so that's a benefit where, there's those collaborative like tables. The other benefit with sitting at the PCN would be that we actually, Island Health sit at that table. So any of their new programs and services that get rolled out, our nation has a nurse working in the Emerge Department. So she's a connect to all the other Indigenous communities. So that nurse's role is really to be the voice of this clinic, to know what our services are. That, we have, for those that are from this nation, she would need to know that, we have mental health counselor, we have an Indigenous medicine person, we have a home care nurse, we have a home care support working team, you have a community health nurse, we have two FTE doctors and MOAs, we have a homeless outreach program. And so her role is to know what our services are. But she'd be an advocate not just for our nation, but every single Indigenous person, meaning knowing about all the resources for the Métis, knowing that all the resources are, at Stenowis and Staminas and those that are traveling to NRGH hospital. It helps. It helps the person walking in the hospital if they don't understand the care. That's an example of one of the projects that we have with Island Health. they also consult us, on Truth and Reconciliation Day, and, when they're opening a new clinic, what are the needs of the community that we would feel is needed. I also sit at Vancouver Island University at their table on curriculum development, and we're quite often asked, we're developing this, and this is the curriculum, and they'll send it. And when I'm feeling very, very ambitious, I'll start reading some of the curriculum that nurses are reading on truth and reconciliation and on cultural safety. And I've been asked to speak at several of the VIU nursing sessions to really speak to what it is a nurse, what is the job of a nurse like in a First Nations community. So those are some of the things that the tables that I've sat at. Amazing the work that can be done if you're willing to be patient. These processes take years. You have to be patient. These are never, over the night when you're doing community development.
You're listening to A Sound Constitution on CHLY 101.7 FM. Now, back to our interview with Connie Paul, registered nurse at Snuneymuxw Health Center. You're on so many committees and on different programs. It makes me think that you might not have a lot of free time. And I know that self-care is so important in the nursing profession, especially for community nurses who are working so closely with the community and their clients. What's your take on self-care? And is there anything that you've brought with you through the years that sustains you?
2 questions. I remember an older nurse took me on as a practicum student. And when I met her, she said, I will promise to give you everything I possibly can, as long as you make me one promise. And I said, what's the promise? She said that in 5 years, when you're comfortable enough on the ward, you will take a practicum student and start becoming a teacher of students, and not just once, to do that throughout your career. And I made a promise to this older nurse that I would take a practicum student, and I would take as many as I possibly could. So I've had practicum students every single year. And so I've had students every single year for probably 25 years, maybe more. And so, that was my way to give back to that one nurse, is that my commitment to, and they keep you sharp. Students keep you sharp. They'll give you an article, go, have you read this? And I went, absolutely not, but I'd love to read it, and then we'll talk about it tomorrow. So, they're wonderful. They help you remain current. I think when it comes to self-care, I always go back to my great-grandmother. And one of the things she did for me, my great-grandma Dirty Lake, we were walking along a path, and she said, she picked up a rock and she handed it to me, and she said, I am the rock. And I was like 5 years old. Okay. And I looked at the rock, and she handed it to me, and I went, oh yeah, my grandma is the rock. My great-granny is really the rock. And she said, you say that. I am the rock. She walked further down the path. We both walked there, and she bent over and picked a blade of grass, and she said, I am the blade of grass. And I said, I'm the blade of grass? No, say it here. Say it here. I am the blade of grass. So I'm like, okay, I'm the blade of grass. When you're 5, it doesn't take long for that magical moment, that magical thinking age where I became everything around me. I was the pine cone, and I was the beetle, and I was the butterfly. I've never forgotten that experience. And over the years, my grandma always said, you never forget that you are the land. And if you take care of the land, then that's yourself, taking care of yourself. That's self-care. If you really, really believe that, then you will take care of everything that's around you, because you are not an individual. You are the land. I think fundamentally it's always been a part of my belief system. I know that in my core that I am nothing and I am everything. So that's always helped me, grounding me in terms of my understanding and my connection to the land and how the land can heal me. I guess the other part, art is medicine. So I'm a painter, basket weaver. I do cedar work. I do bead work. You know, my grandma would say, create something beautiful. Not for the purpose of selling, not for the purposes of being better than anything, but create something beautiful just for the sake of being beautiful. That's what heals me. And you can't wait until you're in a crisis. What do I do? What do I do? What do I do? I'm feeling this way. No, I think you need to build that into your life when you're learning to be a nurse. And that's one thing I took away from nursing, you know, and the ability to forgive, I think, is an important, and to forgive and to let go and to really be aware of your own personal biases, right? And to look at them and explore them and be real with them, you know, because the only one that's truly in the room with you and your client is you. I've never worked. I've always been lucky enough that I've been able to do work that I've loved so much that I've never worked. It's never been work. Mm-hmm. You know, and when it's no longer like that for you, then I encourage you to go, you know what? You only have one life, and you really need joy in your life for your own spiritual wellness. Find work that you really love doing. It's important. And when you love doing it, it's not work. It's joy.
Thank you so much for sharing your beautiful words of wisdom and your stories. I feel so privileged to be able to interview you, Connie. I just really want to extend my gratitude, and on behalf of A Sound Constitution, thank you so much for your time and educating myself and anyone who listens to this program about truth and reconciliation, about working in Indigenous communities, and also about how to be resilient and maintain care of ourselves. So thank you.
You're welcome. Yeah, now you promised me 36 years from now, you'll sit with a young nurse and go, I will be there for them, Connie. I will share my lessons. I will take joy in sharing everything I've known.
I promise, Connie.
There you go.
I will.
Yeah. All right. Well, thank you for your time, and I'm really honored that you took a chance to let me speak. Thank you.
Thank you, Haichka.
That was Connie Paul of Stenemo Health Center in Nanaimo. Tying all the information we've learned so far together is Gwen Phillips of the First Nations Health Authority. In this excerpt, she discusses the fundamental role of culture, language, and tradition in transforming health for BC First Nations.
We've been given a vision provincially that speaks to healthy children, healthy families, healthy communities, but also having a sense of vibrancy. And what does vibrancy mean? How do you measure vibrancy? Our elders said, it starts with the sparkle in the eye of a child. Do our children have a sparkle in their eyes? What does that actually mean for a child to have a sparkle in their eye? It's a sense of belonging, a sense of love, a sense of purpose, a sense of safety, being inquisitive, wanting to know things. For many years, our people were cut off from the transmission of traditional knowledge, cut off from the transmission of sense of belonging. Residential schools, just the processes of colonization in general. The fact that the dominant cultures coming to Canada suppressed and in actual fact didn't even give any recognition to the uniqueness of the cultures that were here led us to where we are today. For us as Indigenous people, we don't want to be called a blanket of Indigenous people anymore. Sure, recognize us as that in a relationship, but to actually acknowledge who we are as unique nations and our languages and how important those languages are to concepts of relationship, to concepts of well-being, to concepts of future. So for us right now where we are, we're trying to remember who we are, trying to remember all of those things that held us together as strong, healthy families, as strong, healthy communities and nations for thousands of years. It's only been 100, 150 years that we've been in this chaotic state. And my elders have always said, if you can remember the taste, you can rebuild the recipe. And that's where we are right now, is remembering what it was like, remembering our language, remembering our songs and our stories, remembering how our families supported each other. We've been embarking on this journey of a health transfer, when really what we're looking at is health transformation. And it's really about transforming systems in general. Because you don't arrive at a health status that is a really good health status without having lived a healthy life, a healthy lifestyle. Now sometimes our behaviors are driven by our circumstances. And sometimes our circumstances are challenging. Either the physical environment, we haven't got clean water, we don't have safe houses. The social environment, we may be dealing with a lot of dysfunction in our family well-being still because of having been cut off from our wholeness, our cultural wholeness. And so as we are looking back to remember who we are, we're also projecting forward in our rebuilding. So it's absolutely important that we remember who we are as First Nations people, as the Ktunaxa, as the Shakpatmuk, as the Intlakapmuk, as those unique nations of people. BC is home to 35 unique languages. So we know we have at least 35 nations in BC. And so this concept of nation to nation, it's about our language and our stewardship responsibilities. That's where our nationhood comes from. Our stewardship is our connection to the land. Our language helps to place us there. And our dialects are different because of where we were placed on the land. Some of us were on the open ocean. Some of us were in high mountain areas. Some of us were in the interior of BC where we see fruit growing areas and plains and rattlesnakes. So our environment is very different, very unique to each nation. So we've got to remember who we are from the cultural perspective. And what colonization really is a suppression of our culture by being oppressed by a dominant culture or cultures. So when we think about the concept of the determinants of health, it's legitimate for us as First Nations people. In fact, it probably meant something to us before the scientists came and branded it as the determinants of health. For us, we knew that our social environment was absolutely key to how people would grow. We also knew that our physical environment impacted us immediately from our home environment to how healthy our broader environment is. When we go back to our cultures, each of us uniquely, we recognize that we had social support networks. We had concepts of aunties and uncles, not just blood relatives, but a role that particular group of people played within our society. The concept of the grandmother, the grandfather, and what their roles were, even understanding that in most of our societies as Indigenous populations, we were actually matriarchal. So in many instances, our women were the ones who ran the camps. They made the rules, they kept the rules, they sometimes even chose the male leaders that would be the protectors and providers. So our gender balance went out of whack with the process of colonization, particularly when we saw that dominant culture coming with the concept of actually the man owning the wife, that the man owned the woman and the minor children. Now that values clash with the First Nations population was significant and deep. Our women ran the camp. Then we were taught we were property. So again, the thinking about what happened to our culture and it's being pressured by this dominant culture. Right now, the balance of our gender roles in our communities is out of whack. Our men have been very badly impacted by the process of colonization. Their roles have been impacted more than the women's roles. Yes, the women's roles absolutely in our inability to be those nurturers and the residential schools taking our children away. We didn't have the ability to actually pass on those skills as nurturers. We have to reclaim those responsibilities again. We know that our gender roles are critical, that if a child doesn't have a nurturer and a protector and provider, they're going without. We also know that our genetics has been impacted by the trauma that's occurred to us generation after generation. The epigeneticists, those scientists who look at disease and genetics, they've actually confirmed that if a child suffers in their early child development, if they don't have a strong social support network, if they don't have the nurturing that is believed every child should have, that they may likely have inflammatory disease later in life. Now, when we look at the rates of diabetes and heart disease and other inflammatory disease across the Indigenous populations, it's extreme. And if you look at our early childhood experience, it too has been extreme. So we know that we have to nurture the man, nurture the woman, nurture the family, help rebuild healthy health practices, help rebuild coping skills.
That was Gwen Phillips of First Nations Health Authority presenting in a YouTube video entitled The Social Determinants of Health from a First Nations Perspective. You can check out the rest of this video on YouTube. All the information will be listed in our show notes.
Thank you to our audience for tuning into this week's episode of A Sound Constitution. And a big thank you to Connie Paul from Snuneymuxw Health Center for sitting down with A Sound Constitution to give context to Indigenous health from her expert lens through working in community. For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, and our Instagram at CHLY A Sound Constitution. If you've missed parts of this episode or would like to listen to this episode again or episodes from our past shows, check out our YouTube at A Sound Constitution or our Spotify at A Sound Constitution. Otherwise, we'll see you all next week.